Yeah, I'm particularly interested in young patients that have myelofibrosis. This is typically a disease that we diagnose in patients in their 50s, 60s, 70s, but we do have, the rare patients that are diagnosed in their 20s, 30s, and 40s. And I think that this is an interesting kind of patient population to look at because we may be able to find some unique characteristics, better understand the disease biology, and find some things that we may not be able to see in older patients who have a lot more comorbidities, right? So perhaps a little bit of a clearer picture here. And so one of the questions we ask is we know this is an inflammatory disease. A lot of preclinical work has suggested that inflammation allows for the outgrowth of some of these malignant clones. And so we actually looked back to see whether or not we saw an increased risk of inflammatory comorbidities in these patients. And interestingly, we saw a lot, right? These are young patients that typically don't have other things going on, but we saw a lot of inflammatory bowel disease, a lot of autoimmune conditions, a lot of cardiovascular issues that may have been able to kind of support the outgrowth of this disease earlier on in life. Fortunately, what we saw is that the prognosis for young patients who have myelofibrosis is quite good, right? And I think that was quite reassuring. But we did see that these inflammatory comorbidities that were present actually predicted a little bit for progression of this disease to higher risk disease. Again, supporting the role that inflammation has and potentially, giving therapeutic options when seeing young patients to say, hey, let's make sure we're not just focusing on the MF, but let's manage these other inflammatory comorbidities as well.